Well, welcome back to our patient education videos. I'm Tiger Taylor, and here's Dr. Sean Miles.
Good to be here, Tiger. Glad you could have me.
Yes. So today I want to talk about the lab abnormality and labs for elevated glucose and your A1c. What does that mean?
Okay, well, let's start off with what is glucose? Glucose, simply put, is a sugar. It's the type of sugar that our body uses on a day-to-day basis. And most people think of sugar and they think of diabetes, so we definitely need to talk about that. And that's where this A1c comes in.
So typically we think of your A1c as the average of your daily glucose numbers over 3 months. And that's how we come up with that number.
Yeah, I think you're right. So the glucose, you can think of that as just a molecule in the bloodstream. We'll call it this. And we also have red blood cells in the bloodstream there. And the glucose gets attached to them the longer they're together in the bloodstream. So what the A1c is actually a measurement of the percentage of the red blood cells that have sugar occupied or glucose occupied. So we have these numbers here, and we use those to both diagnose diabetes and to see kind of how your sugars have been doing over the past several months.
So when we're treating pre-diabetes, what are we looking for as far as a number and what we should be doing to either reverse that or try to avoid moving into the diabetes category?
Yes. So the normal A1c measurement is less than 5.7%. Get up to the 5.7% range and we're talking pre-diabetes.
Which is bad.
Which is not good, right. If you're pre-diabetic, that means you are likely, if nothing changes, going to develop diabetes, which you don't want.
And so what can we do to try to reverse that if we're in the pre-diabetic range, slowly or quickly moving towards diabetes?
Well, by definition, when it comes to the sugar sticking to the red blood cells in the bloodstream, we need to reduce your average blood sugar. So the best way to do that is two things. One, to eat the right types of foods, the types of foods that don't make your glucose go up. So it's low sugar, low starch, foods like that. And then the second thing is exercise. Exercise burns the fuel, the sugar in your body, and lowers it that way. So Tiger, why don't you give us some examples of maybe some low sugar, low starch foods, and maybe I'll throw in kind of the opposite things that are the bad ones.
Right. So actually there's some really good information out there at nutritionfacts.org by Dr. Michael Greger. And he has some great information out there about this exact thing, how we can avoid diabetes. And he talks about diets very rich in plants, so fruits and vegetables, seeds, nuts, that kind of thing, that not only in research showed to totally reverse diabetes, but help people that are diabetic.
And pre-diabetic too, to keep it from progressing to diabetes.
Yes. Either reduce the medications that they take, completely come off insulin. So there's some really great information and resources out there about plant-based diets. So how do you feel about plant-based diets?
I think plant-based diets are great. I really do. And when we say plant-based diets, we mean whole food plant-based diets. Anybody can eat bread and pasta and say that it's plant-based diets. Most of those are vegan, but they're not necessarily good for us because you get a burst of glucose from those starches almost immediately in your body. In fact, those starches start breaking down into glucose in your mouth while you're chewing.
Right, and if you don't believe us, you can put a saltine cracker in your mouth and within 30 seconds to a minute, it tastes sweet.
Right. Try it. Diabetes affects just about every organ in the body. We're talking the heart, we're talking the kidneys, we're talking the brain, eyes, you name it, it can affect it in a negative way. So we need to keep your glucose good so that you don't get diabetes, or if you do have it, you reverse it. Plant-based diets, excellent way to do it. Whole food plant-based diets, watch the sugars and starches. People often say, well, what about fruits? Don't fruits have a lot of sugar in them? What do you tell them, Tiger?
I think actually that fruits are good. The types of sugars that they have are slower to release than things like breads and pastas, and that way you get a more controlled glucose increase rather than like breads and pastas.
Yes, whole plant foods, completely packaged differently the glucose is. So keep that in mind. Choose wisely, choose plants, and I think you'll do well.
Yes. And this is why we enjoy primary care and preventative medicine so much, because just by talking to you all and helping you figure out and navigate this, we can prevent you from moving into the prediabetes or diabetes category. So that's why we love medicine.
That's why. So go, if you haven't seen your doctor in a while, go check. Tell them you need a physical, you need a well visit, and ask specifically for a diabetes screen.
Yes. Be safe and be well. Thanks for watching.